Oh, okay. Well,
I got it.
we'll put it on.
Don't go blocking my way.
You want to sit here?
Right here.
Don't go blocking my way.
The pressure's okay?
It's
A little much? Okay.
Yeah.
So we go back to lighter. Might be like a little bit of fibromyalgia maybe, that tenderness like that.
Really?
In these spots right here, that pretty tender.
The left side more so.
More so, there's some little bit of points for fibromyalgia points there, and there are a lot in the traps when it's pretty hypersensitive like that.
Wow.
Sometimes it just could be a little bit of that generalization setting in.
Do you need any cream or anything?
I don't think so. Is that pressure okay pulling and just
It's
kind
great.
of,
Why
Yeah.
don't you look forward a little?
Traction.
yeah, a
I
little
can just-
traction, a little bit
I
of.
can see fine right here.
Okay.
And also, it feels a little bit like some TMJ stuff might be happening with you too. Could be causing some tenderness. Feel those points and that
Yeah.
point, those are big fibromyalgia points too.
Wow.
But it's workable. Fibromyalgia is just a syndrome. It's not something that you have to get on these medications. You can get rid of fibromyalgia.
If you catch it
Oh,
early.
you can.
You can get rid of it. I've helped people through it.
Really?
They just
Yeah,
tell
you
you
just
to
gotta
come
work
to the doctor.
acupuncture, acupressure, stretching.
I mean, even if you
stretching.
get it like it's far along.
Yeah, you can tone it down. It's just generalization. It's that USIRG. It's the G part. You can step it down backwards. It takes a while. You may have to commit to a lot, you know. So I'm just doing a little occiput release on her here. With her, I would do more static because she's sensitive. So it's just static pressure, not a whole lot of friction and movement would be really ideal. So I'm just holding, just steady, letting her body just adjust to where I'm just hanging out. And that way she can kind of get used to that, breathe through it, et cetera, et cetera. There she goes. Yay. I mentioned breathe and you breathe. How was your trip or wherever you went to?
It was interesting.
I know you were away somewhere.
Yeah, it was interesting. It didn't turn out the way I had.
Expected it to?
Yeah, it's something I've been planning for years.
And just wasn't what you expected.
No.
Well, I guess that's what they say, don't ever expect anything, you know?
Yeah.
Okay, so just lift your ear gently up into my hand. All right, look at her SCM. Great visual there.
Wow.
Right there and here. There's that little spot in between, the line. Look at the thickness of it.
Wow.
Comes to the posterior and covers a bit of this mastoid here. Okay, now relax it. So remember, to avoid the carotid, we turn the head. So this was the back end of it. So I'm just going to take her head and I'm going to roll it over to my fingers to make it as short as I possibly can here. And then I'm going to just flat compression. I'm using that kind of pressure. On her, she needs real light pressure about there, just like that.
Because for some reason it always looks stronger than it really what it is.
Well, she looks strong in her musculature, and you would think, but you can't just look at bodies and know what they're going to actually feel like. So you have to remember, listen to your clients, what they say, what kind of meds they're on, that kind of thing. Now, if any of you do have any things with medical issues, come see me about them so that I know what you're on if I do use you as a demo, like I had said before. Just so we know. I don't know, if she was seizure-prone individual, I would want to know that.
Is that legal and illegal?
Over 70, you know, obesity.
No.
Okay, just checking.
Now I'm just compressing, flat compressions like the toothless alligator. I'm holding mostly static. The pressure's okay right there. Some stuff, little tender, sore, inflamed a little bit right here. So that would be what I would write on my soap notes. Feels a little inflamed. Feels like heat. Doesn't feel like leather, but it feels just engorged with some kind of blood or fluid. you know?
Robin, when you start, do you start from the bottom or do you start from the top?
Middle.
In the middle?
Yeah, and then I work my way towards each attachment.
Okay.
That way you can get a better grip there. Now I'm going to work both heads at the same time. I'm kind of compressing them together. I can individualize those two heads, the clavicular and then the sternal head. I'm just holding static on her, and I'm going to add a little bit more pressure. Is that okay right there? Okay, good. Now I can go to smaller C compression to get this sternal head here. She may have some issues with this portion, this head of the SCM. I can feel like little,
And what are you basically trying to just relieve some of the tension that's around that joint?
trying to cover the entire muscle itself. So every muscle in here, you're trying to cover the whole muscle and hit every fiber and feel what you're feeling in every fiber. You may not know what you're feeling yet, but just go through and touch every part of that muscle. That's what this is all about. Seek and destroy trigger points. And if they don't go away, don't fight them. Try something else. Go around it, go to agonist, go to synergist.
Do you feel a release while you're doing that?
You can, yes. Like as I'm doing gentle compressions, I feel it just kind of softening. So that's that, is it releasing? She may or may not feel it releasing, but you'll probably feel it more as the practitioner, and sometimes the client will feel it more than the practitioner, so just got to keep in touch. Now I'm following it all the way up to the mastoid. While I'm up here at the mastoid, I'm going to turn her head, come to the back portion of it with just 1 or 2 fingers here, and then I'm going to roll the attachment site onto my finger, and I'm just doing static, just static pressure. So I'm finding the mastoid where it attaches at the SCM. See where I am right here? And then I'm just going to do a tiny bit of multi-directional. See how small it is? Just up on the attachment site at the bone.
You're going like really slow, like
Micro mini, real micro.
not like.
Some people you can go faster, some people slower, but we keep about a medium pace in here.
So why are you going that pace with her? Because she's really tender?
She's tender, I'm a little more sensitive, and I want to give her a chance to breathe through some of this, so I'm hitting static instead of frictioning. And then I can just gently do some friction and just microfibering, just feeling all around the bone with my index finger right now where it attaches on that mastoid. Because attachments aren't like the head of a pencil. They can be large sites. So just visualize the size of the muscle and the attachment site, and then friction the entire attachment site where you find it. And so we can do the flat. If I was going to do a little bit more deeper work, I could go to this C compression like so, and I could go in, and this is what it would look like, but I'm not putting any pressure right here. I'm just showing you the maneuver. Yeah, I don't want to sift too, I don't want to
Yeah.
inflame anything more than already done. Do no harm. Now, we've already done this sternal head. I can come to the clavicular head and do a little flat compression there too.
What if your hands are big?
That's okay.
Yeah, like this.
Watch this.
Okay. Then that's,
Ready? Watch this.
see?
I don't have a problem with it.
Watch this. Finger, 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 small finger. So you can do double fingers. You can do gentle compressions like this.
Okay.
See right here, there's a little bump, bump, bump.
Can I feel the level of pressure that you're putting on there?
Mm-hmm.
Thank
Nothing.
you. Okay.
It's like 0. This is what I'm doing on her. Wow. Real, 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 real light.
She's so protective of you.
And just compressing it like that. Just real, real, real light.
You stop.
Now I'm known a little bit to be a little rougher, you know? Too. So
Yeah, we
usually
know.
people that come to me end up, that's what they need.
Yeah.
And then if I'm not the therapist for them, you refer them to somebody that you know that usually does more gentle work. I mean, you can tone it down, but when you've been working with people and tearing their muscles off their bones for years, but you can do anything. You just have to remind yourself of what your client needs. Now I'm just working at the attachment site of the clavicular attachment. Just 1 finger pressure straight onto the clavicle, and then medial lateral friction here. So a little medial lateral friction just going across. Then
Now-
come to the sternal. Go
Mine
ahead.
was all the way down in
because it's rotated.
Oh, okay.
Remember, your clavicle
Yeah,
goes
yeah,
backwards.
Yeah.
She's all jacked up.
Whoever works on me, good luck.
Just work under the clavicle. We can do pecs on you or something too. Now it's just released a little bit at the attachment of the manubrium here. Doo-doo-doo.
Now, when you have a rotation like that, how do you fix that? I mean, how do you fix like a rotation like that? Oh,
Just move it with muscle.
oh, okay.
Work above, below, pec minor, whatever attaches on that clavicle. If you work
Okay.
all of it and then do some range of motion, eventually it's going to have to give back.
Okay.
So bicep tendon also plays in, pec minor, subclavius, SCM, traps, pec major. So all those things you'd have to work to get it to come back and pop back into place.
Okay.
Chiropractor would just take it and go like that or pull it out. But you can do the same exact thing, just working with the soft tissue.
And you can do it all in one session, or it'll take a couple of.
Sometimes it could happen in 20 seconds. Sometimes it may take the whole body to become unrigid, maybe, you know, where it's not holding. Sometimes it can be emotional stuff that holds, or just habitual things that have been set in for a while. Okay, so that was her right SCM. Real gentle, 3 attachment sites, and work the bellies. Okay, so you got the full belly and then you got the 2 separate.
So you start in the belly and then you work towards the attachment and then you come back to the belly and then you go to the other attachment.
Exactly. And it doesn't matter the order.
Okay.
You can go wherever feels comfortable to you that you can find it, because it's all about finding this muscle and how to isolate it from everything else. So that you're not grabbing scalenes and all kinds of other things.
Spot is good.
This is all about mapping out one particular
Can
muscle,
you feel the
just the
spine?
SCM.
Yeah.
Yeah.
So that's why it helps you close your eyes.
Oh, I'm
too.
feeling it.
Yeah, because then
You
I
can
can
take
feel
that
it's
and put
right
it to
there.
your
It's a little
phone.
trigger
I mean,
point,
her
correct?
computer.
Yeah.
Is that radiating up into your head at all? Ear, eye orbit, or is it just generally tender underneath?
Just on that spot.
Yeah, 'cause she's got fiber, which is real medial to her cervicals, and it's about that long, and it runs on the inside here, and I'm in the middle of it right here. And I'm just gonna sift through it a little bit, because it doesn't feel inflamed, it just feels taut to me. The other stuff on this side felt more inflamed and engorged. This is harder, like a pencil or something. You know, the other stuff was more like one of those pens with the little soft squishy stuff around it, kind of like that. That's the only way I can really describe it. One's a big pen and the other's that squishy, fluffy stuff.
So how would you work this side versus what you did to this side?
I mean, this tougher side,
Yes.
a little more pressure, a little bit more
The
fine-tuned. Yeah, because I found that fiber. Now, flat's not going to help me really get into that fiber and start sifting the microfibers open, so I can come into it, pinpoint where I want it, and then just kind
see
of,
that sticking
like a
out?
guitar string, kind of roll around it, roll around it, roll around it, work up, work down, come to the attachment site and come back.
Oh, that's her vein. You sure?
What's that?
I think so. Yeah, because it's going in opposite direction.
This right.
It's a vein.
It's
Yeah.
a vein.
Yeah.
Right here.
It's vein.
Mm-hmm. Carotid, probably. On the outside?
It's a
No,
big one.
It's just
There
a
it is.
vein. It's more superficial than her carotid or jugular is much deeper. It could be just from tightness on this side, maybe scalenes, it could be impinging. Could be partially due to this SCM. So now I'm just sliding up on it, each position. This one's pretty deep right here, this little tender spot right there. I'm on the underside of it. Now the top side, I'm just gonna compress between. Yeah, I kind of have to roll a little bit to get up under there more, to get where I was feeling. Now I'm compressing both of the heads, the clavicular and the sternal head. We're flat, no movement, just static compression.
Now, is it called a trigger point even if it's not radiating?
That's a tricky question. That's kind of tricky because all of them don't radiate, but you may not be hitting it at the right. It may slip off and hide underneath you, you know? So they're not like BBs in a muscle where you have to kind of sift around and really feel for them. So it could be just the residual fibers of the tissues and then it's touching on it, but it's not actually doing a radiation. So it can be just tender at that point. Could be from micro tearing or. So now I'm just switching to this sternal head here. little bit of flat. A little bit of flat. There's a little tender spot, I can imagine, right? There's a little something going on there.
Yeah.
And even right here, like right on this little spot of her sternal head, real superficial to the very top. I'm just doing a little small flat on it. I don't want to go to because it's very close. And it seems like it's pretty tender right here. I can feel her breathing change, heat temperature change, right there. Does that radiate at all?
No.
Just tender.
That is bad.
It just feels ropey to me. Ropey.
But if you as the therapist feel it and feel like it's a trigger point, they might not necessarily feel the pain radiating.
Usually they'll say that's the same pain, or that's the one I'm complaining about.
Okay.
Or they'll say, I feel that in my finger.
Okay.
Or I feel that down my arm. It'll be pretty obvious to them that it's something that wasn't there before you hit that point.
Okay.
Like they'll go, whoa, I get it. That was rough.
Right there.
Yeah. Now I'm just going under her clavicle a little bit just because it's just me working. I just decided that that might help her SCM attachment site here. It may turn the clavicle a little bit. And there's some points right up under her subclavius there. And we'll do subclavius when we get to pec minor. Then the last part over here is I'm going to come underneath. Again, lift your ear gently to the ceiling. See the back end? See those little striations right there?
You're fine.
Those are adhesions in the muscle of the SCM at the attachment site. So I'm going to relax her head, come to the back end of it, roll her mastoid onto where those adhesion spots were. And I'm just going to hold static first. Pretty deep to the bone. Nice flips. I like sparkly.
I need some arch out of that.
You do?
Yeah.
They should make flip-flops, like add-ins, you know? So I'm just working, now I'm doing cross fiber. Now I'm going with the same direction that those striations that you saw. I'm just kind of going with them with a little bit of friction at it. Then I'm holding static again, rolling the head. Her weight of her head is putting pressure onto the mastoid.
So that was her muscle looking that way.
Yeah,
That's the end.
and it's a little bit of adhesions in there, those little striations that you saw. So you can see them on people, like when we do assessments in the back, I'll show you what fascial adhesions look like and what the tautness and tightness looks like.
So are you going straight up or are you curled?
Well, I'm kind of flat-fingered on it, so I'm not pinpointed. Then when I was going, her adhesions were looking like this. So I just found the attachment and then I worked in this direction with it.
You did what?
Because you can always go with the fibers or you can go across the fibers.
Okay, so you went with them.
Yeah, I was going first with them in this direction.
And now they're gone.
Now, kind of moving. You could do like
She has to
gentle
lift them
skin rolling.
for you to
So
see
that's a
them.
light skin roll like there. Real small surface skin roll. Could come up a little bit higher. Could come behind the SCM a little bit here. See if you can get some release in that area. Now, when you're working the attachment, you can have the head turned away from you, but practice with it turned ipsilateral, which means same side, because that way you won't get in the bad habit of doing this. Because if you start working SCM with the head this way, you're going to definitely hit the carotid. And if you hit it too long, especially obesity, over 70, arterial sclerosis, you may set some plaque free from that. So you want to be real gentle with that. Make sure you get into the good habit of working it this way. Okay? So that's SCM. I know you guys can handle it.